We've expanded both in terms of eligibility and in terms of quantity. Last year, we didn't, for example, need more than, say, 4,000 vaccinations. That's what we ordered last year. This year, we've already ordered. We already have over 13,000 vaccinations, and we have another order that we've already placed, and we're waiting for it to arrive. So we have more vaccinations that are available to us. In addition to that, our campaign is specifically targeted both at people who are over the age of 65, because it makes them particularly vulnerable for flu, and we have a separate campaign for children as well. And of course, it also includes anyone who is in between those ages who may be particularly vulnerable as well.
So the government says the vaccination programme will include all children aged 2 to 11, high-risk children aged between 12 and 18, seniors aged 65 and above, and adults who are high risk due to medical conditions. However, you also say you encourage everyone to take up the offer of the flu vaccine. So can those who don't fit into those categories also get it, or is this just a question of prioritising those most at risk?
The flu vaccine will be available to everyone, but we will prioritise the people who are at the at-risk groups first. But certainly anyone who wants to take the flu vaccine, it will be made available to them just as well.
In the UK, all over 50s are now being offered the flu vaccine as of this year. Why has Gibraltar maintained the 65 and above bracket?
This is the advice that we have from the Director of Public Health. This is the advice that we have of the group that is specifically vulnerable to the flu, and we are following the advice. Remember also that our climate is different to that in the UK, and that may well be a factor.
So has the vaccine now arrived? Is it now available? And how is it being rolled out? Can you tell us about the different phases of this programme?
We've started today already, as you know. So we've commenced our strategy today in terms of awareness and in terms of delivery of the flu vaccine. At the moment, anyone can call the numbers that we've advertised on our press release to make an appointment, but we've also got a specific strategy that is targeting, say for example, people who are elderly, and we're looking at going to their homes to deliver it to them and administer the vaccine at home to them if they cannot come and make the appointment themselves.
So you've also highlighted that frontline and essential workers can get vaccinated. Can you tell us about the programme that's available for them?
Yes, we have a programme for everyone who works in the GHA. They are vulnerable themselves because they're frontline, so they're coming into contact with people. So it's important for us that they be vaccinated as well. So that's another way of protecting not only themselves, but only protecting people who may come into contact with them as well. So we have our own internal programme for vaccination at the moment, the GHA, and throughout all our services, both in health and care. We have a programme where everyone is swabbed for COVID-19 on a monthly basis. So what we'll do is when people attend their appointment for their swabbing, they will also have the offer of the flu jab at the same time. So we're running the same programme.
So can you take us through how the confluence of COVID-19 and the flu could be dangerous, A, for those who are high risk, and B, for the GHA in terms of overwhelming the health service?
Well, we are told that medically you can suffer from both COVID-19 and influenza at the same time. So obviously if we can eliminate one from the equation, it means that the person has more chances of being less ill. So that's one thing. And then obviously what we want to do is protect our health services and keep people out of hospital. We know that the hospital demands become greater when we have the flu season, and that ends up in our beds being taken up, and really obviously this year, because we want to make sure that our bed capacity and our treatment is available for people who may suffer from COVID-19. This is an additional safeguard that we have from the community. Also, because symptoms are pretty much virtually similar for the flu and for COVID-19, at least we want to be able to rule out that it's not the flu and treat it as if it were COVID-19, because otherwise anyone who manifests symptoms of whether you've got a runny nose or a cough or anything that is associated with COVID and the flu, and we know that they are similar, everyone will automatically be treated as if it was COVID-19, because we have to err on the side of caution and protect the community.